Well, these days you can order your dinner online, a ride. Well, how about an app that replaces going to a doctor's office just like this one? Well, that's what Maple is all about. It's an online platform where people can pay to see a doctor, even get a prescription. Well, its Toronto creator calls it the future, while others say this is yet another example of two-tier healthcare.
You know, our total wait time from the time that you decided that you wanted to see a doctor till the time that you have a prescription in hand is often less than an hour.
Waiting is no longer the hardest part under a virtual doctor service created by Toronto ER doctor Brett Belchetz.
What I see is about half of the patients in the emergency room that are coming in, they're coming in because they don't actually have an emergency. They're coming in because they have nowhere else to go.
So he created Maple, an online site and app where, with just a tap of the finger, you can see a doctor online, have an examination by phone or by video, and even get a prescription sent to your pharmacy, all for a fee. $49 per visit on a weekday, $79 for weekends and holidays. There is a fee structure. What do you say to people that this is just another leg of privatizing healthcare?
Well, you know, the thing is there are some things that our government chooses to cover and some things that our government doesn't choose to cover. So unfortunately, up until now, virtual care like this is something that the government doesn't cover. It's our hope that that's going to change.
Health Canada says telemedicine is not something they regulate. Rather, they pointed us to the College of Physicians and Surgeons of Ontario. They told us they govern the physicians, not the service, saying in a statement it, quote, has robust policies governing the practice of telemedicine. Physicians are expected to comply with the expectations set out in these policies and utilize their own professional judgment when determining both the course of care and the modality for a patient interaction. If we receive a complaint about the conduct of a specific physician, we will investigate.
Overall, no, it's not a good thing. It's not the technology that's the bad thing. It's really the fees that are the very, very dangerous thing.
The Canada Health Act guarantees all Canadians access to medically necessary physician and hospital services, free of financial and other barriers. OHIP, meanwhile, does not view telemedicine as a medically necessary service. Natalie Mera of the Ontario Health Coalition says the method shouldn't matter.
They're provided to everyone equally. The rich don't get to jump the queue. You know, that is the public health care system in Canada. So if you say that every time you just change a little piece of technology, you're allowed to charge user fees, then there will be no public health care system in Canada.
The biggest lesson is that
Dr. Belchetz says it's his hope the government will bring virtual health care into the fold, making coverage a reality.
There's no question this is the right way. Patients like it more, doctors like it more, and just from a public health perspective, as I said before, it doesn't make any sense that when you need a prescription renewal in January, you have to sit next to somebody with the flu for 4 hours.
Dr. Belchetz says the majority of ailments can be diagnosed online without a physical exam. However, he does admit there are some where they will send you to a doctor's office like this one.